I'm Tiffany Shin, an ambulatory care pharmacist and faculty member with the University of Kansas School of Pharmacy, and I operate under a collaborative practice agreement with the Via Christi Family Medicine Residency Program in Wichita, Kansas. Today we'll be covering the elements of a collaborative practice agreement. To review, a collaborative practice agreement, or CPA, is an agreement between a physician and a pharmacist. Under the agreement, the physician may refer a patient to the pharmacist to manage routine drug care for a pre-specified disease. The doctor and the pharmacist agree on a protocol for the pharmacist to make changes to a patient's medications based on how the patient is responding to the treatment, and the pharmacist communicates these changes back to the doctor within 48 hours. If there are any complications that fall outside of the protocol, the pharmacist simply refers the patient back to the physician. So you want to enter into a CPA, but you may be unsure what elements of a CPA you need to incorporate. We'll look at a sample hypertension CPA from our first video, which can be found on the healthcare provider page at healthict.org. With 50 states, there are 50 sets of rules and requirements for CPAs. We're going to be talking specifically about the Kansas CPA requirements. Different rules may apply in your own state. Remember, a CPA is just what the name says. It's a signed, formal agreement between a physician and a pharmacist to share some of the patient care duties. Here's HealthICT's Sample Hypertension Collaborative Practice Agreement, which can also be found on healthict.org. A collaborative practice agreement can be between one physician and one pharmacist, or, as is the case with this CPA, between multiple physicians and one pharmacist. CPAs must be reviewed and updated every 2 years. To enter into the CPA, it goes without saying that both parties, the doctor and the pharmacist, are required to have licenses in the state they're seeing patients. Pharmacists are required to notify the Board of Pharmacy upon entering into a CPA within 5 days of it being fully signed. As part of the pharmacist's application for license renewal, he or she must advise the board if they have entered into a CPA. Under a CPA, the pharmacist is responsible for all aspects of collaborative drug therapy management, but the physician remains ultimately responsible for the care of the patient. A pharmacist should not enter into a collaborative practice agreement that is not appropriate to the training and experience of the pharmacist or physician, or both. A pharmacist should also not provide collaborative drug therapy management to a patient if the patient is not being treated by a physician who assigned the pharmacist's current CPA. Each CPA and update must be signed and dated by each physician and each pharmacist, and must include a statement of the general methods, procedures, and decision criteria that the pharmacist is to follow. The methods and general structure in HealthICT's example hypertension CPA are outlined through a policy statement and a statement of organization. Procedures that the pharmacist is to follow to document the decisions made are divided into guidelines for who should be referred into the CPA and how visits with the pharmacist should be conducted. Decision criteria are given both in terms of how drugs should be advanced and situations in which the physician should be notified. It is acceptable to have specific decision criteria, as in the example, but it isn't necessary to be this specific. A CPA could more broadly state that the pharmacist may initiate, discontinue, or adjust doses of medications based on professionally recognized clinical guidelines and patient-specific factors. A broad CPA requires a trusting relationship between the physician and pharmacist, as well as a pharmacist with advanced clinical knowledge and experience. Ultimately, the CPA's general methods, procedures, and decision criteria is up to the physician and pharmacist. Finally, statements must identify procedures to be followed by the pharmacist if an urgent situation involving a patient's health occurs, including identification of a covering healthcare provider that the pharmacist should contact if the primary physician can't be reached, and procedures that the pharmacist is to follow to communicate to the physician about changes in a patient's condition and for each collaborative drug therapy management decision made. The CPA regulation should not be interpreted to restrict current procedures established by the hospital or medical care facility pharmacy, the therapeutics committee, or the medical staff executive committee. It should also not be interpreted to restrict the provision of medication therapy management as defined by CMS under Medicare Part D prescription drug benefit. This is the second in a series of videos on collaborative practice agreements. To see the entire series or to request free technical assistance in developing your own CPA, visit healthict.org/healthcare-providers. Thanks for watching.